So finally, we have some good news to report to you on the opioid epidemic, at least in Cuyahoga County. It appears that we are on track to have some of the lowest numbers of overdose deaths in a decade.
Yeah, that would defy a trend that we've seen going now for at least the last 10 years. Senior health correspondent Monica Robbins joining us to discuss what could be driving that trend in the right direction.
Yeah, there's a number of factors because, you know what, not sure we've ever had a moment to report good news relating to the opioid epidemic. And believe me, it is far from over and there's far more work to be done. But this is certainly a highlight and hopefully a trend that continues and spreads throughout the state. Now, experts believe the widespread distribution of Narcan and fentanyl strips are helping, as well as education and awareness campaigns that may be making a difference. Cuyahoga County Medical Examiner Dr. Tom Gilson says it appears we may have the fewest overdose deaths since 2015. Now, last year we had 635 in Cuyahoga County. This year it's projected we will have less than 500. That includes fewer drug deaths from fentanyl, even cocaine. Those on the front lines see it too, but they're also seeing a shift in addiction.
In 23, we're starting to see a huge increase in alcohol. We just started to see it and we're just like, what the heck? Okay. 2024, for the first time ever, my alcohol use disorder has surpassed my opiate use disorder coming through the door into detox.
Now, it is known that alcohol withdrawal can be potentially deadly. And a few years ago, opiate withdrawal was not as deadly, but that's not the case anymore because of the drugs that are being mixed into fentanyl on the street. So, who's still dying from overdose? Well, Negus thinks that many people who didn't think that they needed Narcan, meaning those who thought they were buying cocaine or meth, didn't know it was laced with fentanyl, and they were likely using alone. And there are certainly other factors for the drop. And coming up at 6, we'll hear from Dr. Gilson as well.
Right. That's not just a tiny drop. Those numbers, that's a significant drop of, by my calculations, more than 10%.
Right, and Dr. Gilson, like literally, he calls me up and he's like, I don't understand this. You know, and he checked in with his partners in law enforcement, and he's also seeing that there was about a 50% less seizure rate as well, where so it's almost like there's a less supply and demand as well. So that's what's interesting too.
So we know Sherrod Brown's Fentanyl Act became law in June. Any indication of the impact that might have had on the numbers you're talking about today? You
know what, I definitely think it's going to have an impact, but I think this trend began before that became law. Now, we still have a huge fentanyl problem. That law is going to help cut the flow by sanctioning chemical suppliers and drug cartels that traffic the drug. In addition, the law is going to funnel money to law enforcement to help them stop the criminal enterprises. You know, I'm sure it's already helping, but again, it became law in May, June. I don't think, you know, we're looking at these numbers up until July is where the numbers that we're looking at. So I don't think, you know, the trend started of the overdose going down started earlier this year. And as you heard from Carol Negus, she said that alcohol is becoming a bigger problem. And that's just, you know, that was a big surprise for everyone.
Well, these numbers are certainly welcome, and we'll take it.
Absolutely.
Hopefully they keep going in the right direction.
Yeah.
Mon, thanks.
Thanks, Mon.
Appreciate it.